Hello everyone, welcome back to GrowMed. So this channel is a one-stop guide for the FMG aspirants, and you can find here everything you need for the FMG, the revision videos, then how to read, what to read, the important questions, PYQs, everything. So all you need to do is subscribe to GrowMed and tap the bell icon. So without wasting much time, let's start our video. And today is the part 3 of discussing the liver diseases for the surgery. Already two videos have been uploaded, breast and thyroid. Do watch that videos, and these videos will help you in especially in the recalls ठीक है revisions में. It will help you in the revision to recall all the things very quickly, and this will be like 30 to 40 minutes session discussing all the important things. So हम बहुत deep में नहीं जाएंगे. जो basic जो important है exam के लिए will be quickly recalling that, ताकि आपकी मेमोरी एक बार ब्रशअप हो जाए. और MCQ सॉल्व करने से पहले बस एक वीडियो देख लेना, देन सॉल्व द MCQs, तो ईजिली MCQs भी हो जाएंगे. ठीक है. So let's start our discussion. We will start with the liver abscesses. So three types of liver abscess we must know: amoebic, pyogenic and hydatid. Hydatid like is a must know topic. बहुत बार repeat हुआ है ये question. ठीक है, तो hydatid note down कर लेना कहीं पर. One question you can expect in the upcoming exam also. So amoebic liver abscess, the things which you must remember from this and which are important for the exam, I will be discussing that with you. The causative organism and amoeba histolytica, the name itself says, ज़्यादा दिमाग लगाने की ज़रूरत नहीं है. Amoebic liver abscess, तो amoeba is the causative organism. Then this is important because the infective stage, it is the quadrinucleate cyst, because this has been asked as a question. And then this is the pathogenesis, like how it will be causing the infection. This is not that important. Okay, so this is important because it will be causing flask shaped ulcers in the colon and cecum. ठीक है, तो SI में, small and large intestine में, this will be causing flask shaped ulcer, and it is a remember point to remember, it is a must know. ठीक है, तो flask shaped ulcer, whenever you see in a question, no, then think in terms of this liver abscess. Then another important feature of this one is that it will cause NCOV pus sauce, and due to hepatolysis and necrosis. And this one is the image. This is the NCOV sauce pus. This image is not that important, but still, as we are discussing here, to make it clear, to make you an idea of this NCOV sauce pus, I've shared the image also. Okay, so this is the image of this NCOV sauce pus. Then the clinical features, we know that GI symptom है ना, तो whenever these GI organs will be involved, you can see the features like abdominal pain, fever, fatigue, anorexia, jaundice. And तो see abdominal pain जो है ना, it is like a symptom associated with a lot of organs in the GIT. So based on the location, you can easily rule out which organism the examiner is trying to ask, and also in the clinical practice also. So this one is very important. The triadnito chart जो ये है ना, epigastrium, then gastric, then this one, then hypogastric region, also this one umbilical region, because umbilicus is present here, the umbilical region. Then this one is the hypochondriac, right and left, then umbilical region and the iliac region. Okay, the right and left. So just remember this one. I'll be sharing the video in the video ni photo in the Telegram channel, and mug up this chart, and by this you can it will help you in the exam to get an idea ki which organ is being assessed and which organ is being infected or disease is asked. Okay, so abdominal pain का ये हो गया important point which you must know. Then fever तो रहेगा ही, fatigue भी, anorexia and jaundice, because liver is involved and jaundice is a symptom. ठीक है, तो jaundice रहेगा. fatigue and fever will be like associated with the infection ना, तो जब भी ये चीज़ें दिखेंगी, think in terms of the any infection. And abdominal pain से आप associate कर सकते हैं कि it will be the liver which will be involved. Now the most common LFT abnormality seen in this one amoebic liver abscess is this SGPT will be raised. Okay, then first investigation is the USG. Investigation of choice is the serology ELISA. Okay, so this one is an important thing. Then high dose of metronidazole is required for the treatment, and for the carriers, these are the treatment options available. So this is all which you must know for the amoebic liver abscess, the causative organism, then flask shaped ulcer and curvy sauce pus, and serology. So if let's discuss one thing, that if a clinical case is asked, they can describe with the features like abdominal pain, a man with abdominal pain, then fever associated with fever and so symptoms. On examination, you see that the pain is located in the right hypochondrium, and you see the liver LFT functions deranged. Then what can be the causative organism, or they can also describe that on endoscopy, something like that, flask shaped ulcers were seen. So what will be the diagnosis, or what will be the treatment, or what is the investigation of choice, ऐसे करके कुछ भी क्वेश्चन पूछ सकते हैं. Okay, then these are the complications. What all complications will be occurring if it ruptures? So these are the peritoneal, these are the pleural and the pericardial. Not that important, but as we have been discussing here, so you need to have an idea about the complications also. Okay, so that's all for this amoebic liver abscess. Then moving on to pyogenic liver abscess. Again, liver abscess है, pyogenic है. ठीक है, तो liver abscess में you can see symptoms like abdominal pain, fever, fatigue. तो ये common से symptoms है. Let's discuss the things which will help you to rule out that it is the pyogenic liver. First one is that it is most common type of liver abscess is this pyogenic, and most commonly seen in the alcoholic male. So in a clinical case, if you see history of alcoholic males, then think in terms of pyogenic. Then route of spreading. Okay, so bile duct is the most common path or tract by which it spreads, and cholangitis, it is called as the cholangitis, inflammation of this bile duct. Then portal vein, hepatic artery, and direct invasion will be the other routes. So clinical features already discussed, fever which is abdominal pain, anorexia, and all this similarly रहेंगे amoebic liver abscess के साथ में. Now the lab parameters increase with the ALP is the most common. Then this is just important. Then first investigation USG, second is aspiration and culture, and this is the treatment: percutaneous catheter drainage and symptomatic antibiotics. Okay, so for the pyogenic, so the thing which you must remember is first one, the alcoholic males, whereas it is the most common type, and this one, aspiration and culture, is the investigation of choice, whereas for this one it was the serology. Okay, then hydatid cyst, you just cannot miss any point of this hydatid cyst because it is very important and famous question asked in the FMG. Okay, so this is the causative organism, echinococcus granulocyst, and so it, as it is a zoonosis, now it is spread from the cat or the dog animals. Okay, so look at the history of any pet animal given in the patient. So if any pet animal, then a patient comes with abdominal pain in the right hypochondrium, fever, anorexia, fatigue, and on USG you see this finding, this finding. What will be the diagnosis? Clear cut answer is the hydatid cyst. This image is called as, this sign is called as the water lily sign, seen on the USG of the hydatid cyst. Quite famous image, and if at all you are a repeater, you might have seen this image like multiple times while solving the MCQ. Okay, then this another organism is also this echinococcus multilocularis, and this one is the host. This is also important. The definitive host is the dog, then intermediate is the sheep, and the accidental is the man. Then the infective stage, X are the infective stages, and these give the hexcanth larva. So it can go into the portal vein causing the liver abscess, or it can go through the IVC to the lungs. This one is not that important, just remember that the infective stage, hexcanth larva. Then symptomatic, so mostly asymptomatic. Clinical features, hepatomegaly can be seen, but the patients, like most of the patients, will be asymptomatic, and if symptoms persist, then it will be like abdominal pain, discomfort, and dyspepsia. The most common complication is the intrabiliary rupture. Then first investigation to be done is the USG. You can see a rosette appearance. Then on CT you can see ring-like calcification, and investigation of choice is the serology. Then treatment is perioperative. You will be giving albendazole. Then these are the surgical methods available. One is the PER, then cyst evacuation plus omentopexy, pericystectomy, and hepatic resection. So the full form of this pair is puncture, aspiration, injection, and the reaspiration. Puncture. Okay, so this is the full form of this surgery, and in this the aspiration of the cyst, contents of the cyst will be done via using an injection, and then again reaspiration. So first we'll puncture the cyst, then do the aspiration using an injection, and again then reaspiration. Okay, so this one is this method of the surgery. And an important classification for this one is this Cabrera classification. In that stage 1 you can see simple fluid collection, then 2 will be the floating membrane, 3 multilocular, 4 complex heterogeneous mass, and 5th will be the calcified cyst. Wait, let me show the image of this to you. Okay, so this one is this classification, Cabrera's classification. First one you can see only a simple fluid collection is there, a simple cyst, then a floating membrane, then a multilocular, this will one will be multiple lobules will be seen, and then complex heterogeneous mass, and then the mass gets calcified, so type 5. Okay, so this one is all about the hydatid cyst. Then moving on to some liver tumors which you must know. So these are simple one liners which are being asked. So the most common metastasis, the most common type of tumor is due to the metastasis. Then most common primary malignant is the hepatocellular carcinoma, whereas malignant in the children's is the hepatoblastoma. Then most common benign is the hemangioma. Then second most common is the Fmge, focal nodular hyperplasia. Okay, so let's discuss about the benign tumors of the liver first, and then we'll move on to the hepatocellular carcinoma. The questions asked and what all you must know for the exam. So the most common type is the hemangioma, and this one is associated with the OCPUs. All are associated with the OCPUs, and these are, so this was a PYQ that which of the following tumors are associated with increased use of OCP, and it was the hemangioma. FNH is also associated, and hepatic adenoma is also associated. So you can like associate that these are like a contraindication or risk factors. OCP increases risk factors of which of the following tumors, and hepatic adenoma was there in the option. Okay, so are you getting my question? The question can be twisted and two types of questions can be asked. First, they can either give that OCPs increases risk of which of the following tumors, or they can give that this tumor, hepatic adenoma, female using OCP, something like that. A female who was using OCP for her so and so disease now comes with the complaint of liver pain and all these things, a tumor, liver, hepatomegaly. What can be the cause? So it will be the OCP intake which is causing this hepatic adenoma. Okay. Then these are mostly asymptomatic, and these are asymptomatic, whereas these are can be symptomatic, and abdominal pain is the association. Then this hemangioma, so hemangioma you all know that now it is a tumor of the blood vessels. Hemangioma quite easier, and hemi tumor, and angioma. Angioma means blood vessel. So blood vessel of the tumor, tumor of the blood vessels of the liver. Then two types, capillary and cavernous, and the size, if it is less than 5 centimeter, then you will be doing just the symptomatic treatment, and if it is more than 5, then it is called as the giant hemangioma. And investigation of choice is the MRI. Then on MRI you can see peripheral nodular enhancement, and treatment of choice is the enucleation. So the things which you must remember from this one is this: MRI is the investigation of choice, and treatment enucleation. Then moving on to FNH, focal nodular hyperplasia, hepatic architecture is maintained in case of this one, and investigation of choice, this is a repeat topic and a must know topic. CECT we will be doing, and on CECT we can see this central stellate scar, and on the angiography we can see cart wheel pattern or spoke wheel pattern. Treatment is observation plus excision. This one is for this FNH. Then of the hepatic adenoma, hepatic architecture is not maintained, and the investigation of choice again CECT, peripheral hypervascularization can be seen. Treatment is the excision. Okay, so these are the benign tumors and the associated points which you must remember. Now speaking about the hepatocellular carcinoma, so we'll discuss all the important things which you must know for the exam. Firstly, that it is most common in the males, and the most common cause is the HPV, hepatitis B virus. Okay. Then in HCC, you can see vascular invasion, that is from one branch of the portal vein, it spreads to the other branch of the portal vein involving the whole liver. Okay, so it is multicentric and bilobular. Both the lobes of the liver will be involved in case of this hepatocellular carcinoma. And these are the risk factors for the hepatocellular carcinoma: cirrhosis, metabolic diseases like the Wilson's disease, in which there will be increased level of the copper, then environmental factors, then pathological types, so hanging, pushing, and infiltrative. Just remember the pathological types, no need to go that much deep in this. Then the clinical features already like know that abdominal pain रहेगा, weight loss रहेगा, fatigue, anorexia, jaundice, tumor rupture, all these things. These are like common manifestations, common symptoms seen in all the GI diseases. So we'll not be discussing much about it. We'll be just discussing the points which you must know, which will help you to reach the correct answer if at all this is asked in the exam. So these are the paraneoplastic manifestations seen with this liver, and this one is important. You need to know this one. Though among of these things, that hypercholesterolemia can be seen, hypoglycemia, erythrocytosis, and hypercalcemia can be seen. Paraneoplastic manifestations. Okay. Then these are the tumor markers. So these was also the PYQs. Questions were asked on this. AFP alpha fetoprotein and increase in the PIVK. So this is a new marker, and it should be more than 20 mg per ml AFP. Then investigation, first is the USG, or the investigation of choice for screening. See, remember one sentence, that investigation of choice for screening or first investigation. For most of the liver diseases, it will be the USG. USG is not the investigation of choice, it is for the screening. Okay. But to confirm the diagnosis, confirmation investigation of choice will be varying, particularly according to the disease. Like in case of hydatid cyst, it was serology, which is the investigation of choice. And for this pyogenic liver abscess, aspiration and culture and high darted के लिए it was the serology. Whereas first investigation सबके लिए रहेगा USG. When we are screening comes positive, then we will be going to the confirmation tests. Okay. Then triple phase CT, investigation of choice for the diagnosis. ठीक है. Then staging, you will be using this Okuda classification, and the things which you'll be seeing is the bilirubin levels, albumin, tumor size, and the ascites, remembered by the mnemonic PATA: bilirubin, albumin, tumor size, and the ascites. So this is the Okuda classification used for the staging. Then these are the treatment options. So BCLC, then this one is the Barcelona, I think, then Milan's criteria, then unresectable this. So this treatment part is not that much important, because questions are not asked on this the एग्जैक्ट क्वेश्चंस की ये वाला यूज़ करेंगे, मतलब कौन से क्राइटेरिया कैसे यूज़ करेंगे, बट यू नीड टू हैव एन आइडिया, सो रीड इट डाउन. ओके. So these are the things from the hepatocellular carcinoma. Then moving on to fibrolamellar variant of the hepatocellular carcinoma. So you can see fibrous stroma with the lamellar structure. So break karo name. By breaking the name only, you will come to know what is the exact pathogenesis of this. You can see fibrous stroma with the lamellar structure. So this is well subscribed and non-encapsulated tumor, slow growing and young patients. Okay, so hint word can help you to reach the diagnosis, because whenever you see a young patient with these features, then think in terms of fibrolamellar. Not associated with hepatitis B, HCV, and cirrhosis. That's why it is having good prognosis. Again, investigation of choice CECT. You can see central stellate scar. Treatment is the resection. And in India, this one is most commonly seen in the females than the males. Okay. So fibrolamellar variant. Then hepatoblastoma. So hepatoblastoma, we had discussed that most common seen in the children, congenital type का होता है ये, and most common primary malignancy यहाँ पर already discussed earlier. Most common primary malignancy in children, hepatoblastoma. So the things which you must remember is that it is associated with the FAP, familial adenomatous polyposis, and Beckman-Whitman syndrome. Clinical features are asymptomatic intra-abdominal palpable mass. So this one is the most common clinical symptom, and then thrombocytosis can also be seen. So this is the spread, hematogenous spread, and site is the lung. One statement, remember that whenever you see hematogenous spread, then the most common organ will be the lungs. Okay. And in case of other GI diseases, if it is like spreading through the portal vein, then it will be going to the liver. So liver will be the most common site for metastasis in case of other GI diseases like the rectal, CA, then anal cancer, stomach cancer, and all these things. Take two statements to remember. Then investigation of choice is the biopsy, and the radiological investigation of choice is the CECT. Then treatment is the resection, and for metastasis you will be using this neoadjuvant chemotherapy plus surgery. Okay, remember these chemotherapeutic agents because this can be asked in the exam. Then portal hypertension. So again, a important topic, and questions have been asked in integration, like with the alcoholic male. A alcoholic male with binge eating comes with the hematemesis. What will be the cause of this hematemesis? So it will be due to the portal hypertension. There will be variceal formation, and due to which there will be variceal bleeding. So this is the normal blood pressure of the portal vein. So when do we call it hypertension? When it will be going more than 10 mmHg. Variceal formation will be occurring at this pressure, and when it exceeds 12 mmHg, more than 12, your variceal bleeding can be seen at the lower third of the esophagus. Then the causes, most common is the cirrhosis, whereas schistosomiasis can also be there. Whereas in case of children, it is extrahepatic portal vein obstruction, obstruction at the confluence of the splenic vein and the SMV. Okay, investigation of choice is the Doppler. Then at lower 3 centimeter of the esophagus, we have already discussed this. Now how do we manage it? Management, you will be using 2 large bore IV cannulas, मतलब कि you will be going this fluids. ठीक है, IV fluids चालू करेंगे and fluid कौन सा देंगे? रिंगर लैक्टेट देंगे. Then cut off BP should be 100 mmHg and the hemoglobin should be 8%. Then pharmacotherapy, you will be giving octreotide and terlipressin plus nitrates. In the gastric lavage, room temperature saline you will be giving, and antibiotics for 7 days. And first investigation is the endoscopy, and during the endoscopy you can do endoscopic variceal ligation, and this one is most commonly preferred because another method is this endoscopic sclerotherapy, but this as a risk factor of causing perforation, so this one is avoided and endoscopic variceal ligation is preferred. Okay, सो द थिंग्स विच यू मस्ट रिमेंबर फ्रॉम दिस वन, द मोस्ट कॉमन कॉज, मतलब कि क्लिनिकल केस के प्रेजेंटेशन में यू कैन सी एन अल्कोहलिक मेल विथ पिंज ईटिंग ऐसे करके विथ हेमेटमेसिस. सो इन्वेस्टिगेशन ऑफ चॉइस, देन द मैनेजमेंट, दिस इज इम्पॉर्टेंट. Then so portal systemic anastomosis site, so this one is important, and this sometimes a clinical case can be described that a patient, he is having portal hypertension and he is having bleeding per rectum, which will be like classified as the hemorrhoids. ठीक है, तो hemorrhoids इसका cause नहीं है, but bleeding occurs due to this rectal varices. I think you are understanding. ठीक है, तो यहाँ पर along with the esophagus there are various other sites where this variceal formation can be seen. esophagus का तो हमने पता कर लिया ना, जैसे कि this one is the liver and this one is the esophagus. So the cirrhosis will be happening, there will be no flow of the blood, obstruction के वजह से variceal formation will be occurring, and then it will cause this hematemesis. Likewise the caput medusae, another feature seen with this, and audible venous hum can be heard, and this one is a murmur which can be heard on the abdomen, given with this name of Cruvelier Bramhagen Baumgarten murmur. ठीक है, then if bleeding is not controlled, then we will be repeating the endoscopy, and if endoscopy is failed by 2 times, then we will be using the shunt or the tips. So these are the 2 tubes which are used in case of this surgery. Sengstrom Blackmore tube, it has 2 balloons, one gastric balloon and one at the esophageal side. So we will inflate this balloon with the saline so that to stop the bleeding, and the another tube is this Linton Nachal's tube. So look at the images, because image based question can be asked on this. Till now they have not asked, but क्या पता future में पूछ ले. ठीक है, then this one is this tips surgery, in which you will be anastomosing this right hepatic vein and the right portal vein, and for cannulization you will be using right internal jugular vein. ठीक है, not that much important, don't go much deep into these things because they are not like asked in the exam, and क्यों फालतू में hectic schedule बनाना अपने, मतलब hectic होना ये सब चीज़ों के लेके. ठीक है, not that important, if you skip this part also it is okay. So just remember these ones. Shunts वाला पढ़ लेना because questions have been asked on this shunts. So classified into selective, non-selective and partial, and these are the types of the non-selective: ic fistula, SSP, CS, interposition graft, and these are the selective. Okay, then moving on to the Budd-Chiari syndrome. So in case of this Budd-Chiari syndrome, what happens is this: there will be hepatic venous outflow obstruction. हेपैटिक वीनस आउटफ्लो, मतलब कि वेन से ब्लड जा नहीं रहा है बाहर, जिसकी वजह से ऑब्स्ट्रक्शन होगा. सो द कॉजेज आर द HVT, हेपैटिक वेन थ्रोम्बोसिस, एंड दिस वन This one is the HVT, hepatic vein thrombosis, a common cause in the Western countries. Investigation of choice is the venography because vein is obstructed, right? Then IVC obstruction, most common in India, and venocavography we will be doing. And this one is a treatment option, transcardiac membranectomy. Whereas the clinical features already we know that ascites, मतलब ascites, hepatomegaly, abdominal pain, jaundice, encephalopathy, fatigue, ये सब तो रहेंगे ही रहेंगे about the clinical features. So these are the things which you must know from this liver, and in the next video we'll start with the gallbladder and we'll discuss all the things from the gallbladder which you must know. Okay, so till then watch the other two videos and revise these notes, solve the MCQs, and you can solve the MCQs from anywhere, from the FMG solutions, Marrow Q bank, or any other Q bank which you have. Okay, so thank you so much for watching this video. Like the video, share it with your friends, subscribe to GrowMed, and please note, write down in the comments below, was it useful to you, how much did you understand this video. Thank you so much guys. Once again, this is Dr. Padmini, your mentor for the FMG. Thank you. Bye bye.